She said, I'm Karen Hussey, the Associate Director of HR. Well, I am at the moment, but I'll explain a bit at the end why that's changing. No, I'm not getting the sack, but, I'll explain at the end. My presentation is really about engaging for success and enhancing performance through employee engagement. I will link into wellbeing, but it's overall engagement. I'm quickly going to cover lots of aspects, who we are, our engagement philosophy, because we believe it is so key to the success of our organisation, our communication strategy around that, and how we actually achieve success, which I'll concentrate on, some of the outcomes we've realised and the future. So who is SEPT? We used to be South Essex Partnership, but we've expanded greatly over the past couple of years, and we now come under the brand of SEPT. We're a provider of integrated care, and that covers everything from mental health, learning disabilities, social care and community nursing. And it also covers not only Essex, but now Bedfordshire and the Luton area. We're an employer of approximately 6,000 staff, and if you look back 18 months, we employed 1,900 staff, so we've rapidly grown over a very short period. We've now got an annual turnover of about 300 million, and we operate from 200 locations in those localities, which brings its own set of nightmares. Just a flavour of why should I be up here saying what we've done about engagement? Are we any good at it, really? The last staff survey results, which one of the earlier speakers said were important to look at. Look at your survey. What are your staff saying to you? We got excellent scores in many aspects. And in fact, in 28 of the 38 question areas, we came in top 20% of organisations. And particularly important for us was the overall engagement score of 3.9. And looking down the list, good communication between senior management and staff. Our trust was saying 59% that it was good, compared to the average of 31%. Also, at last year's Healthcare 100 Awards, we won 7 awards, the key one being the top NHS employer. But particularly important for us was around the Staff Engagement, Empowerment and Partnership Working Award. So, what is our engagement philosophy? It honestly is part of everything we do. We don't sit down one day and go, right, we're going to tackle engagement today. And we have been doing it for a long time. It's just part and parcel of what we do. And I have to say, there is so much support from the top of the organisation. Our chief executive and board are so supportive that this would never work without their support and their leadership in this direction. And again, we have very visible management. They go out and sell that we are taking engagement forward, that it is meaningful, that we do want engagement, and it isn't just the tokenistic, oh, we'll engage with a few staff, see what they say, and then just carry on and do what we're going to do anyway. And linking to that, and vital to that, is a wellbeing culture, which a lot of the other speakers today have given examples of their successes. But that is integral to engagement, and it's very important to us that staff get involved in their own wellbeing. It's not our job to give them wellbeing. They've got to come on board with us and take that forward. Effective communication, which I'll explain a bit more about, and real consultation. That's both in the planning of services and what we do, but also in the massive change agenda facing health at the moment. We're going through a massive change programme, integration of 3 other organisations within our trust, and also a massive cost improvement programme, and we've got to have the staff with us as we go through that process. How do we achieve success? A vital element was action planning and feedback systems. We had to listen to staff, customers, service users, what they were saying, but also we had to feedback and say what we were doing. We've implemented the You Said We Did initiative, which there are posters around, it's on the intranet, leaflets. So giving feedback that staff or customers have said to us, this is not quite right, we're not happy with this. It could be a complaint, it could be a serious untoward incident, but we've said what action has happened from that issue being raised. Sometimes we have to say, well, no, we couldn't do that about it, but we've also done this. So it's giving real feedback, showing that we're listening. We've got the Champions Network in many things, including equality and wellbeing. We've got an engagement team that was just a refocused HR team. So there's no additional resources to this, just as some of the other speakers said, we haven't got pots of money to fund this. We've got a wellbeing steering group headed up by a chief executive with key directors on board. We utilise online resources a lot, directing people to resources and tools that could help them, not telling them how to do it, but giving them choice to access. Shared good practice across the whole organisation and the 3 new organisations we've just taken on. And I think the overall key that I would say is the management buy-in. Line managers are the organisation voice with the workforce. They've got to be committed to engagement, else it just won't work. And we've now got engagement and wellbeing on the management development course and also the leadership course that we run jointly with Yale. It's also part of their objectives and it's also part of appraisals for line managers in terms of what are they doing about engagement and wellbeing. So the communication strategy, very quickly, one main problem for us was tackling the geographical spread. We've got many sites. We had to use creative methods to get the message across, but also a consistent method. So we use intranet resources, the internet, also daily communication with staff. Trust Today, just giving an update. It could be a success story of somebody getting a qualification. It could be that we've just acquired a new service. So it could be anything. Again, the visibility. Managers had to go out there and give the same positive messages and take that forward. And very much so in the organisation I work for, more than any other I've worked for, is about the recognising achievement, recognising success and celebrating it. Again, whether it's individual success, a team success or the organisation going forward. And as I've said, the listening and feedback mechanisms, they've got to be real. I won't go into the detail here, but we've got many communication activities. One that's really popular with staff, and we use the same model for patients and customers as well, is take it to the top meetings, where there are key directors and the chief executive, or for the patients, there's the consultants and senior medical staff. They have a lunch or they have a dinner, and they literally have open questions from the people there. They can ask anything, and believe me, they do. And they will try to answer it, obviously get back to them if they can't answer it there and then. So particularly to wellbeing, linking to the other presenters, it is integral to our engagement culture. The two go hand in hand and you can't separate them. There's top-level support leadership again for the wellbeing initiative with the chief exec chairing our wellbeing group. And we've got the Shape Your Life initiative that has been going for at least 7 or 8 years, way before the term wellbeing was trendy or sexy within organisations and business. And that similar thing, we have activities information. We've got the HR engagement team that coordinate communications and messages, and they spend time localising regional and national initiatives because one size doesn't fit all in the terms of wellbeing. In terms of outcomes of effective engagement, we've got a stable, motivated workforce. That's the feedback from the staff surveys. We've got fantastic results. We've also got an improvement in patient survey results. Year on year, it's improving, just as the staff survey results are improving year on year. We've got a reduction in sickness absence and turnover. We've got a much more stable workforce that are coming to work much more. And we've got success in winning bids. We've just taken on 3 new organisations in the last couple of months. And also we've got effective working relationships with our representatives within the Trust. The future engagement of SEPT. My role is changing and I'm going to be the Associate Director of Engagement. and that's quite a progressive step, particularly in health. And also it's bringing together the patient and staff engagement agendas, because we believe it's not about engaging with patients or staff or the public, it's just about engaging with people and bringing them along with our organisation. Again, we'll do more around sharing good practice. We've taken on 3 new organisations that have good practice to share, so we need to share that and not reinvent the wheel. Maintain the momentum. These are very difficult times for health, both in cost, restructures, changes, what's the future hold. So we've got to keep taking the staff with us, so keep that momentum. And look at really the customer journey mapping together with customers and patients and staff about their journey in the organisation, what we can do about that. I think just quickly to sum up, 3 messages that we have as our mantra around engagement in SEPT. It's always meaningful, never tokenistic. People can see through that. It's always honest, good or bad. They want the truth. And always essential, and it's never an option. Thank you for your time.